What happens during the PTCA? A doctor, usually assisted by a cardiac technician, a radiographer and a nurse, will perform the procedure. It's performed under local anesthetic with light sedation if needed. The initial stages of an angioplasty are similar in many ways to a cardiac catheterization. The procedure itself takes about an hour or so. In addition, it takes time before and after to prepare you and tidy up again. You will be asked to lie on a narrow table, and electrocardiogram or ECG leads will be attached to your upper back and near your waist to allow the heart rhythm to be monitored. After the area where the catheter will be inserted has been cleaned, sterile drapes will be placed over you. Under local anesthetic, a fine needle is put into the artery. Normally, the femoral artery in the groin is used, but some doctors may use the arteries in the wrist or the elbow. A guide wire is then passed through the needle, and the needle itself is removed. Next, a small sheath is passed over the guide wire, and this remains in the artery until the procedure is finished. Through this sheath, a fine flexible tube, called a guiding catheter, is inserted into the artery. This is then fed, under X-ray guidance, up to the narrowed coronary artery. After the initial stinging of the local anesthetic, you should feel only light pressure. During the procedure, the blood is usually thinned down with heparin. This is a relatively short-acting anticoagulant drug given to reduce the risk of blood clot formation. In addition to heparin, other drugs that reduce the risk of blood clot formation may also be given. These affect the platelets in the blood and are called 2B, 3A inhibitors. They are given via a drip that is usually continued for 12 hours after the procedure. The guiding catheter is positioned in the origin of the narrowed artery. Through this, the doctor threads a fine guide wire. This is done while observing the arteries on the X-ray screen. The guide wire is placed across and beyond the narrowing. Once the balloon is in the correct position, the balloon is inflated for up to a minute at a time. During the balloon inflation, you may experience chest pain. Do not worry, but do tell the doctor. This usually disappears quickly once the balloon is deflated. As the balloon expands, it compresses the fatty deposits, called plaque, against the lining of the artery. It may be necessary to inflate the balloon more than once to achieve a satisfactory result. Before the balloon is removed, X-ray pictures are taken to check that blood flow has improved. After the balloon catheter is removed, the plaque remains compressed, and blood flow is improved through the artery. The balloon may induce a small tear in the inner lining of the vessel, called a dissection. Blood clots may form on this and threaten to block the artery. This is usually dealt with by inserting a coronary stent. After discharge from hospital following PTCA, about 1/3 of patients may develop a re-narrowing of the artery called restenosis. This occurs at the same site, usually within the first 3 to 6 months. To try to reduce the risk of restenosis, Your doctor may implant a coronary stent. See the section on coronary stents. Most catheter laboratories are set up in a way that allows patients to watch parts of the procedure on the X-ray monitor if they wish to do so. The X-ray camera moves around during the test and may obscure the view from time to time. During the test, you should feel very little discomfort. Chest discomfort may be felt as the balloon is inflated. Occasionally, the injection of dye may cause a brief feeling of nausea, headache, palpitations, a flushing sensation throughout the body, a sensation of passing urine. These are all normal and will quickly resolve.